Just in the past few hours, doctors in South Florida say they have identified another case of monkeypox. The disease so far appears to be spreading in the gay community, and the outbreak likely originated in Africa. The Broward County Health Department in Florida says the risk of contracting monkeypox remains very low to the overall community. They say if a person has received the smallpox vaccine, it is likely cross protection against monkeypox, likely and low. Sort of like in the same way COVID wasn't airborne and couldn't spread between people. Depending on the strain of monkeypox, as we're looking at, I don't know what right there, can kill 10%. 1 in 10 people who can get monkeypox can die. In fact, the World Health Organization now says, well, there's not much to worry about maybe, but to avoid large crowds. Remember, the World Health Organization are the same people who lied to us about COVID at the behest of the Chinese. Now we should avoid large festivals and expect more cases. So the question would be, why shouldn't we believe the World Health Organization or the CDC or any other expert on monkeypox? Because it's not like they've been, wrong in the past couple of years about anything. Dan O'Donnell, host of the Dan O'Donnell Show, is with us. Dan, I just saw your tweet. You say, hint, we should not be panicked about monkeypox, but do we really know whether we should be or not?
Well, look, we've spent the last 2 years being panicked over a virus that we've learned over 2 years of studying data is not nearly as deadly as it was originally feared to be. Moreover, the novel coronavirus was, in fact, novel. This was something that humanity really hadn't dealt with before. And unless it's determined that monkeypox originated in the Wuhan Institute of Virology, we've had monkeypox outbreaks in the past. The overwhelming majority of people do have painful skin lesions, and this is something that takes weeks of recovery, but it is not especially deadly. In fact, most scientists say, Leland, that it's far less deadly than the 1 in 10%. Near as we can tell, this is spreading by sexually transmitted.
Dan, as much as we appreciate your brilliant medical discussion about how monkeypox spreads, I think we can sort of spare ourselves that.
Fair enough.
Fair enough. But it goes to this. You have these statements that are given, by the Broward County Health Department. For example, likely cross protection against monkeypox remains very low to the overall community, on and on and on. And I feel like the scientific community has not yet learned the lessons of COVID, which is everything we thought we knew often evolves. And these sort of very dogmatic statements that are made with assuredness often tend not to be true.
That's actually an excellent point. And this is why the scientific community should be very careful about making more pronouncements. It seems as though over the last 2 years, a lot of them have been tuned out, whether it was mask recommendations or avoiding big crowds. We just got done. Well, I'm not going to say we're done, but we're coming out of a 2-year pandemic, which resulted in the most draconian measures for battling it that humanity has really ever seen. I don't think people across the world are ready now for the monkeypox lockdowns, if those are coming.
Whether or not anybody's ready for it, nobody wants a lockdown. But I'm thinking about what President Biden said today about whether he was concerned or not with monkeypox.
Thus far, there doesn't seem to be a need for any kind of extra effort beyond what's going on. And so I just don't think it rises to the level of the kind of concern that existed with COVID-19.
Cue the tape from January 2020, buddy. I mean, there's a real chance this does not age well.
It certainly is possible. And that is to your earlier point about making these blanket pronouncements about what a virus is going to do. It sort of speaks at a deeper philosophical level to the arrogance of man, that we are sort of the master of our own universe, when we can be laid low by the unpredictability of virus. I mean, this hubris I just don't get.
No, it's stunning to me. And I think about covering President Trump in 2020 at the beginning of COVID. You literally could have taken that soundbite and Trump could have said the exact same words. He probably did. Yeah. He said he was completely under control of COVID, and look what happened. So you really hope here it's not here we go again, but There you go. We're going down some road. Dan, good to see you. Thank you. Thanks for watching. Click the red subscribe button below so you can get more of News Nation's fact-driven, unbiased coverage.